Hi everyone, this is Rick MacDermid here with Senior Solutions Group, and I've been asked by my team to update our Medicare 101 video. So those of you who would like to learn about Medicare, we're not going to talk about all the co-pays, all the deductibles, every single plan, but I'm just going to give you a good foundation today on Medicare, how it works, what is Medicare Advantage, how that works, what are the pros and cons of Medicare Advantage, Medicare Supplement Plan, how to enroll in Medicare, and some mistakes you want to avoid. So let's get started. So a little bit about myself. I've been helping people understand Medicare since 1995. I love my job. I really feel like we're adding value to people, and putting people's needs first is more important than anything that we do. We have a lot of clients that are elderly that have been with us for many, many years now, and they rely on us. Maybe their kids aren't involved in their life, or they get bombarded by commercials and ads on TV and solicitation calls from boiler room call centers from who knows where, trying to push one plan. And our main objective is to educate and inform. I've had several people that I've met with today. One lady came in with a sheet from her friends that she typed out. Her one friend told her to get this plan, another friend told her to get this plan, and she was more confused than ever. So our main objective is to help educate and inform you. And if you take this information and digest it and want to watch it again, share it with a friend, feel free to do so. And if you haven't subscribed already, please feel free to do so as well. So by the way, that's Frankie right there. He is our insurance dog, and he often comes into the office and greets our clients. We can help people in person or over the phone. It doesn't matter if you live in our state of Washington or if you live in Oregon, Idaho, North Dakota. We're here to help. So we're going to talk a little bit how to enroll in Medicare, what Medicare covers. We're not going to get into all the nitty-gritty. We're going to talk about how to fill in the gaps, the difference in supplemental plans. We're going to touch on those, and how to choose the best plan for you. So for people that are working, you may not need to enroll in Medicare quite yet, but I would advise you to get Medicare Part A. So if you are not working, you would probably want to enroll in Medicare. And the way to enroll in Medicare is you can go on Medicare.gov or Social Security SSA.gov. You'll need to create a user account. And this is going to be, for some people, the hardest part. Because creating a username, verifying your identity, there are some steps you need to follow. So go to the government website. We also have a link on our website. So at seniorsolutions.net, we have a link to help you enroll in Medicare. So if you go to our website at seniorsolutions.net, you can choose which option is best for you. Option 1 would be for people who are turning 65. So if you're within your 7-month enrollment window, you can choose option 1, that's surrounding your 65th birthday month, 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. Now, if you miss that window, or if you decide you want to work, I had a person come in today, they wanted to work till they're 70 and then take Social Security at age 70. Well, you would want to choose option 2. So there's a couple forms you'll need to have filled out and send those off to the government, and you'll be enrolled in option 2, Part B of Medicare. Option 3 would be for people who are past age 65 in 3 months and have credible employer insurance, and they have not signed up for either Medicare or Part A or Part B. In this case, it might be easier to call Social Security or call us. We can help you as well, telling you what you need to do. So enrollment is automatic if you're already on Social Security. So your Medicare card will automatically, magically appear if you're already on Social Security prior to age 65. Enrollment is not automatic if you're not on Social Security. And your Medicare card will look like this. It'll be red, white, and blue. It'll have a Medicare number with your name on it and your effective dates, which will be Part A and Part B. Those of you who are working past 65 can elect to delay Part B with no penalties. So don't listen to the people that tell you that you will be penalized if you don't sign up for Medicare A and B when you turn 65. You can work till you're 85. So if you decide you want to work as long as you want, you can. There's no penalty if you delay Medicare Part B if you're working and have credible health insurance through your employer. Now, once you enroll in Medicare, you'll have an initial enrollment period, which is called the IEP. That is when you first turn 65 or enroll in Medicare. It's 3 months prior to your birthday month, and 3 months after your birthday month. The annual enrollment period is when everyone and their aunt is trying to sell you insurance. So you'll get cards, may look like this, that look official, that look like you need to enroll in Medicare, you need to sign up for these extra free benefits. Those are meant to lure you in, and 98% of those are for Medicare Advantage, not Medicare Supplement insurance. Special enrollment periods are for unique situations. We're not going to get into those right now today. If you move out of state, or if you become eligible for low income or Medicaid, you can get a special enrollment period and change your plan at any time during the year. So you have 8 months to sign up for Medicare. Once you leave your employer, don't take the full 8 months, because something could happen within those 8 months health-wise. So the 4 main parts of Medicare are Part A and Part B, Part C and Part D. Part A is your hospital insurance. There's no cost. Part B is your medical insurance, and it does come with a cost. Part D is Medicare drug plans or prescription drug coverage. Part C is Medicare Advantage plans. So Part C is actually not Medicare. So people on Medicare Advantage are not on Medicare. Now they're eligible for Medicare, but they have decided to use a private plan instead of Medicare. So we're going to talk about that in a little bit. Part A is free. Part B is not. It's usually $164.90. And Part A covers hospitals, Part B covers doctors. So Part A is inpatient care, Part B is outpatient care. So Part A will cover your hospital stays, skilled nursing care. So often what will happen is you'll go to the hospital. Let's say you have a broken hip, a stroke, heart attack. The hospitals will keep you for a certain amount of days before they stop getting funded by the government. So if the hospital doesn't get any more funding, their incentive is to discharge you to a skilled nursing facility for rehab care, where you can get that rehab care done much cheaper than if you were in the hospital. Medicare Part A will cover short-term rehab care stays in nursing homes in certain situations, as long as you meet all of Medicare's criteria. So if you're on plain Medicare, and you don't have a supplement to Medicare, and you don't have Medicare Advantage, these dollar amounts over here on the right would be your responsibility. So if you want to avoid having to pay $1,600 each time you're admitted to the hospital, or up to $48,000 if you're there for an extended stay, then you're going to need either a supplement to Medicare or a Medicare Advantage plan, unless you're on the VA and you have full VA benefits. Or if you have private health insurance through an employer, or a spouse's employer. So again, you can get up to 100 days of skilled nursing care benefits in a skilled nursing facility, and your copay would be up to $200 a day unless you have a supplement. So we're not going to talk about everything here. Part B covers 80% of your outpatient care, so that would be doctor visits, anytime you ride the ambulance, go to the ER, have cancer treatment, chemo, radiation. Medicare Part B would cover that at 80% after you've met a deductible, which is going to be a little over $200. Most people pay about $164.90 unless you have a higher income. If you have a higher income, guess what? Uncle Sam's going to make you pay more for Medicare, and they go back 2 years based on your taxable income. So if you have questions about that, reach out to your accountant, or you can reach out to us at Senior Solutions Group as well. We're here to help in any way we can. So again, Part B covers 80%. You're responsible for 20%, and there's no limit to that 20%. So if you get cancer, 20% of the bill could be tens of thousands of dollars or more out of your pocket. Now, let's cut to the chase. The insurance companies are going to focus on Medicare Advantage most of the time. And here's why. So when you're on Medicare, original Medicare A and B, that's the first step. The next step is to decide if you need additional coverage in addition to Medicare. So if you don't want to pay those out-of-pocket costs that I just showed you, you can sign up for Medicare Supplement, also known as Medigap. And these are standardized plans. They're all lettered A, B, D, G, K, L, M, and N, and plans C and F are no longer offered if you've not been on Medicare prior to 2020. So the insurance companies get paid a premium if you sign up for a Medicare supplement plan. And the time to do so is within 6 months of starting Medicare A and B. If you wait past 6 months, more than likely you're going to have to answer an extensive health questionnaire to determine your eligibility. And depending on the state you live in, a Medicare supplement plan might cost you as low as $50 a month, maybe $90 a month. Here in Washington State, the most popular plan that we offer, Plan N, is going to be starting at around $140 a month. And different companies will charge different premiums. So with a Medicare supplement plan, Medicare is the bus driver. The insurance company is just along for the ride. They don't have the keys of the bus. They're just riding shotgun. So Medicare's driving the bike. The insurance company's riding along in the sidecar. They go wherever Medicare goes. They pay when Medicare pays. And the insurance company may get $100 to $150 a month based on the plan you select. Or what you can do is you can hand the keys of your Medicare bus over to an insurance company. So in that case, now the insurance companies may get paid $1,200 a month, not from you, but from taxpayers, maybe up to $1,500 a month per enrollee. So if you get these flyers in the mail talking about all these extra benefits, this one says you can get up to $164 back in your monthly Social Security check. And it talks about cost reduction savings from the Social Security Administration's Extra Help program worth $5,100 per year. These are lures. So when you go fishing, you have a lure to attract the fish, right? So these lures are going to be barraging you either in the mail, on TV, with these celebrities. You may have seen them, the Joe Namaths, the Jimmy Walkers, the Captain Kirk, you name it. They're paid pitchmen, paid by most of the time they're paid by these third-party vendors that sell your name to a boiler room call center. And these call centers are often manned by young 20-something newly licensed agents, and they're only told to offer Medicare Advantage as the only option. So I'm not going to bash Medicare Advantage. I'm going to educate you, because we have clients that have Medicare Advantage and we have clients that have Medicare Supplement Plan. So we have clients that have handed the keys of their Medicare school bus off to a private insurance company, and we have clients that have Medicare as the bus driver with an insurance company just riding shotgun. So with Medicare Advantage, if you're an insurance company, what would you rather get? Would you rather get $150 a month from a policyholder as a monthly premium, or would you rather get $1,500 a month? The answer is clear. That's why we're seeing so much of a push for Medicare Advantage. So with Medicare Advantage, if the company gets up to $1,500 a month from taxpayers, the insurance company is driving the bus now. They often will require you to go to a provider that's in network. So if you go out of network, you may pay 100% of the costs out of pocket. As long as you know that going in, great. As long as you're okay with that. Some people are okay with that, some people aren't. Also with a Medicare Advantage plan, You may have more prior authorization requirements. So I talked to a lot of nursing home admitters, social workers in hospitals, billing staffers in hospitals, doctor's offices, and nursing homes they tell me time and time again, it's a lot more work, often, not always, but often, to process claims for Medicare Advantage. Often claims are denied. More information is needed. Well, we need this, we need that. So the insurance companies, their loss ratios are going to be maybe similar with a Medicare supplement and a Medicare Advantage plan. So let's say the loss ratio, so if the insurance company gets $150 a month for you to be on a Medicare supplement, option 1, where Medicare is driving the bus, not the insurance company. Let's say after they've paid out claims and paid commissions to the agents, they're able to keep a third of that when it's all said and done, $50 a month. And then if the Medicare Advantage plan, even if their loss ratio is 80%, 20% of $1,500 is still a lot more than 33% of $150. So you see where I'm going with this. There's a lot more money to be made with Medicare Advantage. As a matter of fact, this just came out yesterday, Humana 2023 forecast brightens with higher projections not for Medicare supplement business, but for Medicare Advantage business. So Humana made significant investments in its Medicare Advantage business more than a year ago, and it appears to be paying off for the insurer. So we see infomercials, Humana's buying up 30-minute blocks of time on cable channels to push Medicare Advantage as an option. So it's projecting to add 775,000 Medicare Advantage members this year alone. I went to a conference in DC a couple months ago for NABIP, the National Association of Benefits and Insurance Professionals. So there were about 600 of us there at this conference. And Jonathan Bloom, the Deputy Director for CMS, got up and said in the room that, and it's on one of our other videos, if you want to check it out, we'll have a link to it, that 60% of people in Medicare in 10 years will be on Medicare Advantage. So if Humana's making all this money, they're showing huge growth with Medicare Advantage, where they're actually going to make billions of dollars in profit. Looks like $2 billion in profit the last quarter. Yeah, their Medicare Advantage jumped 11% to more than 5.6 million people in the quarter. So lots of growth. If you have stock in Humana, you're sitting pretty good right now. So they're talking about billions of dollars, not hundreds of millions, but billions of dollars in profit, primarily fueled by Medicare Advantage. And as agents, we had a client that came in today. She was talking to her neighbors and her friends, and she gave me the permission to show her. She brought in this sheet. She typed this out, and I want to show it to you. She went on to 1-800-Medicare, or she went on to Medicare.gov, and she put in a list of her medications: Jardiance, duloxetine, metformin, atorvastatin, alendronate. And so what we'll do is we'll take your medications and help assist you to make sure you're on the best drug plan. Because not all drug plans cover Jardiance. Jardiance is the most expensive drug by far that she takes. Several $100s a month. And we'll make sure she's on the best plan. But her neighbor said, well, you need to enroll in this WellCare Value Drug Plan. That's the one I've got. And you also maybe need to look at Aetna, Medicare Eagle, Medicare Advantage Plan without drug coverage. Well, these two hand in hand should work good, shouldn't they? No, as a matter of fact, you're not allowed to do that. So getting advice from your friends and neighbors may work out for you, but it may have about the right percentage of asking what drugs your friends are on. Maybe I should take that drug too. So it could have harmful side effects if you take a drug that is not appropriate or suitable for you. The same thing applies when you're looking at Medicare planning, because if you take a plan that your neighbor's on, so your neighbor might be on this Aetna Medicare Eagle plan, PPO Medicare Advantage plan, but they might have the VA and they may not need drug coverage. Or if you're on the Medicare Value Script PDP plan, well, in 2023, Eliquis is no longer Tier 3, it's a Tier 4 drug. So one of the things that's not fair, and one of the things we're talking about our Congress people in DC, and one of the reasons I went to DC, is people that are on Medicare Advantage have an extra 3 months to sign up for a different plan. So if you go to your pharmacy in January or February or March and your drug is no longer covered, or if your pharmacy is now out of network, guess what? You can change your Medicare Advantage plan up until March 31st. But if you're on regular Medicare, you can only change it by December 7th. That's not fair. People on regular original Medicare should not be penalized if their pharmacy goes out of network or if their insurance company changes the formulary on their drug plan. Now you have to get a different drug or go to a different pharmacy. Or if your premium went up and you didn't catch it, so we've had many people where their premiums go up on their drug plans and they don't catch it. Maybe they're on vacation. Maybe you're visiting your kids over the holidays, over Thanksgiving, you get back. Oh, what's this letter? Oh, looks like my premium went up by 4 times, $80 a month now. Well, if it's December 8th, you're out of luck. But if you're on Medicare Advantage and that happens, you have until March 31st. Call your congressman and tell him this needs to change. Do yourself a favor. We're fighting for you, but we need everyone's support. We need to get this changed. So back to Medicare Advantage. When the insurance company's driving the bus, driving the boat, driving the motorcycle, they may require more prior authorizations. They may or may not deny care for expensive procedures or sometimes inexpensive procedures in hopes that you will give up. Oh, my claim was denied. Oh, honey, I guess I can't get that test done. Okay, well, oh well. Don't give up. File an appeal. You have a right to appeal the insurance company's decisions. Now, if you file a second appeal, studies have shown that over 80% of those appeals are overturned in full or in part in your favor. The insurance companies don't want you to know that. They would rather you give up on that procedure. So that's typically not going to happen with regular Medicare. So with regular Medicare, your supplemental company cannot overturn what Medicare approves. They can't stick their nose in things and muck up the process. Now, the downside of having a Medicare supplement plan is you don't get dental, you don't get any vision, you don't get hearing aids covered, and usually you don't get a gym membership or some of these extra perks that these celebrities are promising you or these cards are promising you in the mail. You're getting plain vanilla Medicare. It's kind of boring, but you're going to sleep really well at night knowing that you can go to any doctor that accepts Medicare. Here's an example of Plan G. There's no networks. You can go to any doctor or hospital that takes Medicare. No referrals. You can go straight to a specialist. This year there's a $226 annual deductible, and then there's no copays or bills. It's the same coverage nationwide. And if the insurance company decides to pull out of the area like they can with Medicare Advantage, so if Humana stops making money for Medicare Advantage or any Medicare Advantage company, they can pull out of your area at the end of the year. Now you're having to find a new plan. That will never happen with a Medicare supplement plan. With a Medicare supplement plan, the downside is they can and they will raise your rates. So when they raise your rates, in some states you have a birthday rule. So on your birthday month, you can change your plan to a less expensive plan. In our state, you can change your plan year-round, no health questions in Washington state. So Washington's one of just a small handful of states where you can change your plan year-round. So the downside to Medicare supplement plans is you're going to pay a higher premium. You can save a ton of money getting Medicare Advantage. If you stay healthy, so from ages 65 to 75, you'd have basically just an annual exam, maybe have a couple colds, maybe an ER visit for a broken leg. It's not going to be that big of a deal. If you break your leg skiing, you get it repaired, and you're not going to have a lot out of pocket. Maybe several $100s out of pocket for that ski accident. Now, but if you get cancer and you're on Medicare Advantage, you may pay up to $10,000 per year for that treatment. Whereas with a Medicare supplement plan, you might pay a couple $100s and change. But on the Medicare supplement plan, you're paying maybe $150 a month for that plan. And you have to buy a separate drug plan if you want drug coverage. Now, when you buy a standalone Part D drug plan, you got to watch these like a hawk. Because the same companies that offer Part D also often offer Medicare Advantage. So the standalone Part D drug plans every fall, right around mid-September, will send you an annual notice of change letter. Don't assume it's junk mail. Keep that letter. We send our clients a letter every year. By the way, we're constantly reaching out to our existing clients if there's rate increases or if there's changes in their drug plan to make sure they're always ahead of the curve. So if you don't have an agent, you don't have someone that you're talking to, feel free to reach out to us. We're here for you. Getting back to these drug plans, remember, the insurance companies can make a lot more money with Medicare Advantage versus having you on a standalone drug plan where they may get $50 a month instead of $1,500 a month. So if you were the insurance company, let's put you in their shoes again, would you rather get $50 a month or $1,500 a month? So they're more likely to change your Part D drug plan if you're on a standalone plan versus having a Medicare Advantage plan. So the Medicare standard deductible for Part D this year is $505. Most of the Part D drug plans have that deductible. So if you're on Eliquis, Xarelto, some of these inhalers, you're going to pay the first $505. So we had a client come in yesterday. His doctor put him on Xarelto, and he was shocked when he went to the pharmacy, and it was over $600 for that first initial deductible. So you could go on warfarin or Coumadin, but then you have to go get your labs every month. So Coumadin is a lot less expensive than Xarelto or Eliquis. But Eliquis and Xarelto are very popular now. Most of these standalone drug plans will make you pay the first $505 up front each year. The Medicare Advantage plan may not make you pay that $505. Instead, you would pay a copay of maybe $50. And then you would hit what's called the donut hole maybe midway through the year. Now the donut hole is going away in 2025. What that basically means is once the cost of your drugs hit a certain amount, you have to pay 25% of the cost of that drug. So if the drug is $600, you're going to pay 25% of $600, which is a lot more than $50. So if you're a Medicare Advantage company and you change someone's drug plan, you're risking that $1,500 check from the taxpayers by messing with the drug plan. The standalone drug plans don't have the incentive to keep you as a customer. As a matter of fact, there are carriers that if you sign up for their drug plan, for their standalone drug plan, some of these carriers will actually go around your agent and send you a letter that says, since you enrolled in our standalone Medicare drug plan, we want to let you know that we offer Medicare Advantage. So the reason they're doing that is they would rather get up to $1,500 a month from the government instead of $50 a month or $100 a month for that Medicare drug plan. So again, just be careful that you understand what Medicare Advantage is. We have a lot of clients that have Medicare Advantage and they really like it. But I have a big problem with how Medicare Advantage plans are marketed as the send you to the moon and back plan. Everything's going to be better with Medicare Advantage. There's no downside. There's pros and cons to all of this. There's pros and cons to Medicare supplement insurance. Not everyone can afford a supplement. The rates can go up over time. You don't get the dental and the vision. The Medicare Advantage, you can get a low premium, maybe a zero premium, maybe even money back on your check. So if an insurance company so desperately wants you on their Medicare Advantage plan, they may pay for all of your Medicare Part B premium as an incentive. Why would they do that? Out of the goodness of their hearts? No. They're in it for profit, so they will often ration your care, make sure it's medically suitable for you to get that treatment done. At their discretion, they could require prior authorizations. When you're on regular Medicare, you're not going to have that. But you're not going to have any of the extras either. Again, this is not a one-size-fits-all solution. So you need to ask yourself, what's best for me? And if you don't know, you can call a CHIP volunteer, or in our state, Sheba. So these are volunteers that are often seniors that have been on Medicare. They understand it. They've taken classes. They've gotten certified. They don't get paid, so that's the good part. But some of them have better training than others. They can't help you actually enroll in the plan. They're not licensed to do that. So if you want to actually enroll in a plan, you have to go through the plan itself, Medicare.gov, the plan's website, call an 800 number, or contact an agent. If you don't have an agent, you can reach out to us at Senior Solutions Group. Now, here's the downside for some people going through agents. Agents, like us, we make a commission. And some agents put commission first. With Medicare Advantage, sometimes they'll make a triple commission the first year. I know in our state, all of our Medicare Advantage people, we make a triple commission the first year for brand new to Medicare Advantage. So the incentive is for some of these agents that work for these big boiler room call centers to only sell Medicare Advantage. And if you call those call centers, they may only show you Medicare Advantage. Only if you beg and plead will they show you Medicare supplement plans. Our practice is to show you both option 1 and option 2 and let you decide. It's what's best for you. So we're not going to focus only on Medicare supplement plans. We're not going to focus only on Medicare Advantage. We're going to give you the broad, big picture so you can understand what's best for you. Everyone's different. Everyone has different needs, and needs can change over time. You can't always sign up for a Medicare supplement plan after you've been on a Medicare Advantage plan. The Medicare supplement companies are only required by law to accept your application within the 6 months that you're new to Medicare. So if you're on Medicare Advantage and now you have cancer or a lot of health problems and now you want to get on a supplement, now it may be too late. As long as you know that going in and you're okay with that and you have adequate savings to pay those copays, that's great. Or if you just don't want to pay a higher premium for a supplement, that's another reason to maybe look at Medicare Advantage, as long as you know the pros and cons. I'm not going to bash Medicare Advantage. I'm not going to bash Medicare supplements. These are run by insurance companies that are in it for profit. My job is to be your advocate. We have to represent the insurance companies as well. So we're kind of like a go-between. So we want to help as many people that need help as we can. We're not here to conquer the world. We're not here to sign up 100,000 people like some of these boiler rooms do. We are a mom and pop company. We give hands-on service. We will fight for you as much as we can. If you want to use us or just talk to us or have a question or two, reach out to us at Senior Solutions Group, seniorsolutions.net. Thank you so much for watching this video. If you'd like to check out our other videos as well, feel free to do so as well. And have a great rest of your day. And blessings on you. And I wish you nothing but the best and the best health. Thank you so much.